Oh, Julian?
Hello, Mike. Hey, Mike, did you know that you can transplant behaviour?
What?
Yeah. Tell you what, let's chat to the guy who's done the study on it.
Hi, I'm Mike Brampton.
And my name is Julian Hoad.
Welcome to Veterinary Ramblings.
Hello, everyone. Before we delve into today's guest interview, we've got some exciting news to share. This week's episode is being proudly sponsored by Adaptix.
Size matters, especially when it comes to diagnostic imaging. So if you work with exotic animals or reptiles, Adaptix is the perfect fit. With a detector size of 16 by 24 centimeters, it's ideal for capturing detailed images of whole skulls, including nasal passages and temporomandibular joints. Plus, it's perfect for imaging orthopedic joints like elbows and stifles, making it a must-have for exotic patients.
But don't let its compact size fool you. Adaptix packs a powerful punch when it comes to diagnostic capabilities. If you want to learn more about how Adaptix can revolutionise your practice, check out the link in our show notes or visit adaptix.com for additional information.
Holger, great to see you. And
It's so great to see you guys.
Nice to meet you again, Holger. Yeah, nice to meet you.
Is it Dr. Hare, Professor, or Professor Hare, Doctor, or Professor Dr. Hare, or Hare, Professor, Doctor? So what is it? Because you're at least three professors.
I think you can call me Holger. It's totally fine.
Are you sure?
Just don't call me Olga, which is the normal thing how you pronounce it. Yeah, because I'm rather not female. I don't intend to be female as either. So perhaps you never know. Perhaps in the world of sex fluidity and gender fluidity, it might happen. But at this moment of time, not.
We'll call you Holger tonight, and then maybe in a year's time, if you change your mind, then we'll But Michelle and Julia will have Holger on, and we'll revisit that.
Fantastic.
I like the name Julia, actually. I think that probably suits me.
I see. Now, we have a habit, I'm afraid, Holger, of getting right in and asking the difficult questions at the start, and it's something that we've often shied away from. I think to our detriment. I think if we ask awkward questions at the start, we're all then at ease. There's no more awkward questions to come out, and then everyone feels happy with the way things are going. So, can we ask you a difficult question now? Do you mind? Can we ask you?
Sure, go ahead.
Is that all right? I say we. I always get Mike to ask it because I chicken out. But he asks it so much better.
Oh, what? You're going to chicken out again?
I am, absolutely. I'm taking a glass of wine. I'm drinking. I can't speak drinking wine.
I think this is terrible because one day you're going to ask this question. You are going to ask this question, and I know we've received counselling about this, and I've been coached on this, Holger, because sometimes it's difficult, particularly with somebody you've only just met, and you and I have only just met, and I don't know whether is it a vagus nerve thing that causes that build up of tension in the stomach, and you don't want to really speak or get it out? But I mean,
don't feel nervous, Holger, by the way. We're not building it up for anything.
I'm getting scared a bit.
Okay, I mean, but as I say, we have been coached on this, and the best way of doing it was just to ask the question, really, wasn't it, Julian?
I think so. Straight out with it.
Just straight out with it. Okay.
Straight out with it. Yeah.
So
I also don't like shit sandwiches. You just say something nice and then you say something bad, and then you say something nice again. So I'm just waiting that you say something bad.
We don't say anything nice ever. That's us.
We haven't said anything nice yet.
It's all shit with us.
I'll tell you what. We'll come on to the. Oh no, I'm missing. I'm doing that thing again, aren't I?
Yeah.
Okay, so here we go. 3, 2, 1. Holger Volk, what's your favourite bread?
Well, rye bread,
Okay.
There you go. Fantastic.
So is that a dark rye bread, a pumpernickel, or a lighter?
No, just the normal. I mean, pumpernickel is a bit too much for me. Too much fiber.
Mm-hmm.
They do those tiny
or you know, if you
slices.
need more saliva to eat your bread, then you know,
Yeah,
it shouldn't dry in your mouth, right?
I've tried pumping liquor with gravy, with pretty much every sort of fluid you can think of, and it's dry, isn't it?
No,
Right.
Right?
no, I
Look,
eat it with pickled herrings, and if you put the vinegar from
Yeah,
the pickled herrings on it,
yeah,
and
I'd need to have a few extra omeprazole if I did that. But look, there you go. There's a rye bread that I made a little while back.
Oh wow,
Just
beautiful.
show you the little
That's a
cottage
lovely-
loaf shaped one. I make a couple of loaves a week of all sorts of flavors, and rye bread's one of my favorite. But it's not everyone's cup of tea. It can be quite a rich texture, can't it?
yeah.
We've got this interview sort of all mixed up a little bit. And I'll lump the listeners in on a secret that actually some of this may have been asked before, because we've done our little trick of forgetting to press record. So thanks very much, Holger, for acting completely surprised to all of those
Completely
questions.
surprised.
You're brilliant. But actually, it does lead us on quite nicely, I think, to food, because you wouldn't naturally think, you're a neurologist, you're a neurosurgeon, you're a neurophysiologist, you're all those things to do with neuro. But I want to talk to you about food, because is it true that food is quite important in certain neurological conditions? I'm thinking specifically here of epilepsy, canine and maybe feline epilepsy.
Yeah, definitely. We've done a lot of work on it, and I can truly say that all my research is shit now. So we did, we looked at how the microbiome changes depending on treatment between dogs with and without epilepsy. We haven't done so much feline epilepsy work yet in that field. Cats are often a little bit understudied, I think. But yeah, and we've done recently a very interesting study, which I think you might find interesting, is that we transplanted behavior from dog which had a really good response to phenobarbital to dogs which had like really difficult response. They were truly drug resistant. And what I found, flabbergasting, to be honest, is that the dog which had a good response, he had a very low, what we call ADHD-like score. So often, dogs don't become ADHD, but they obviously have
So similarities to the human condition, but
yeah,
not the same
100%.
thing.
Yeah, exactly. Yeah, and impulsivity control issues, concentration issues, and so on. And the interesting thing was when you look at this score, which was developed by another group, that our donor dog was down here, and then actually all the epileptic dogs which were drug resistant were up here, and then we could just move them down to the donor dog. So we transplanted literally the dog's behavior, which I thought was unbelievable, right?
Wow, this is like fecal
Okay,
sorry.
So you could theoretically, transplant each other's behavior if you wish.
Okay, was this done under anesthesia? Good dog, good dog, good dog, sit, good dog, sit.
No, yeah. Actually they tolerate it really well. So I'm sure, you have heard about inflammatory bowel disease and people now doing FMT, fecal transplants. And and the classic one is that they use they get the poop and then they implant them rectally. But the trend goes to poop pills. Right, so you dry freeze the poop and then put it in pills and then you give it to the dogs. Yeah,
but the transplantation of the microbiome had the effect of changing the recipient dog's behavior.
Yeah, and there's a lot of research out there. When people experiments, when people have depression, they gave it to they did fecal transplant in rodents, and they suddenly had the same or anxiety type of disorders. And it's really interesting. Yeah. And I guess, we always think we are alone, but we have a lot of friends. We have more microbes in our gut than cells in the body. So they have a big influence how we feel, how we are.
Call me legion, for I am many. Yeah.
That's incredible.
Me, myself, and I becomes a totally different meaning.
I need to, my brain needs to pause for a moment with that. So we're actually by performing fecal transplants, we're altering behavior.
Yeah.
And I guess you can sort of see that on a general level, can't you? That if you've got an upset stomach of any sort, then you're naturally going to be irritable. And an irritable bowel can make you irritable as well. But this is on a much finer level, isn't it? A much more metabolic level. And talking of metabolic, I guess a few years back, the excitement was all in metabolomics, wasn't it? Looking at massive spectral studies of every chemical that is produced within our bowel. Are those studies still being done, or is it?
Yeah, we definitely still do those fishing exercises, and but it has been quite a bit of a challenge because we got so many targets, but then it was very difficult to identify which they actually are, because there's still quite a big work to be done to identify some of them. And yeah, I mean, we have done, to be honest, the biggest hits we got when we use targeted metabolomics. So you can use under-targeted, so you just say, let me see what is different, or you say, look, these are the whatever 300, 400 metabolites I want to look at, and these are key, and then you look at them, and that often is more rewarding than actually using an untargeted approach. But I think it will change now because AI is taking, it's coming into play in a lot of areas of doing those omics. So I'm sure that will change at one stage. Yeah,
I think AI is going to change a lot of these things. It can just work through huge amounts of broadly disparate data much more accurately and quickly than we can, can't it?
Yeah.
I think just to blow my trumpet for BSAVA a little bit. One of the early metabolomic studies was funded, I think, by a Pet Savers grant, wasn't it?
Yeah, it was. So, yeah.
Well, maybe Pet Savers will look towards funding an AI one. That's
it would be nice,
Let's watch this space.
Yeah, it would be nice.
Well, I mean, correct me if I'm wrong here, Holger. And this obviously isn't my topic. This is your whole life. But isn't there a train of thought that talks about using triglyceride in the diet to help control things like epilepsy? I think we see some of that coming across from the human side, don't we, where patients are put on a ketogenic or a high fat, low protein and zero carbohydrate diet to control the symptoms. Are there any parallels there on the veterinary side?
Yes, sure there are. I mean, this is quite an interesting work been done in people. Actually, we know for quite a long time that when people with epilepsy were starving, that they actually suddenly had a better control. Obviously not all of them, but then based on those findings, they developed one like a classic ketogenic diet where you go high in fat and low protein, low carbs. And when feeding this, then the people had a better response. The challenge of using and saying this in people, they use it mainly in children, I guess, because you can control, the environment more than us, who especially, at that time of the day, we all want to have some carbs. But the thing is that when you do this in dogs, you have to be a little bit careful, because when they're on phenobarb and potassium bromide, they might get pancreatitis, right? So the elegant way around this is feeding them medium chain triglycerides. So they are medium, so they are not short, they're not long, they are C8 to C12, and the mains one are C8 and C10, and they have a very high ketogenic yield. So they get metabolized very quickly in ketones, and C8 can also be used directly by mitochondria. So you have a different energy source, and that's an interesting thing. So we do know that in the aging brain and also in the epileptic brain, your mitochondria are diseased as well, and they can't readily use what we always say, sugar. And actually, it looks like that the ketone bodies are a better fuel for them, and they're more effective on them.
Right.
I could talk all night about mitochondria. I love them. I'm not going down that path because I can see Mike looking at me with that stare of, no, don't go on to mitochondria because you're so boring. But it's fascinating, isn't it? We're studying essentially a protobacterium that has taken over our cells, and we can survive without them. You spoke about there being more
and it's
bacteria than there are cells in the body. if you add mitochondria to that, well, yeah.
Yeah, it's the only, mitochondria is the only thing we can really blame on our mother, right?
Yes. Well, but a couple of other things. But yeah, no, you're right.
Yeah.
But biologically, yes, you're certainly certainly right.
The mothers give us energy, as they did.
But let's move away from that, shall we?
Yeah. Yeah. No.
So now I want to explore, if I could, unless you had anything else to add, Mike.
Just intrigued by I do have a question, actually, if we can stay on the topic just for a moment there, because obviously I'm fascinated by the corresponding the translation between animal and human and the whole diet thing. I mean, medium chain triglycerides, where do they fit on the spectrum? Is that lamb fat?
No.
What is
so it's a good question to ask. We don't get it naturally so easily from diets. There's only a very, very tiny percentage in pigs, pork, right?
Okay.
And yeah, I mean, the main source I think nowadays is coconut oil, where you purify it from. Coconut oils, you obviously have also other long chain fatty acids. So yeah, and because of a lot of people doing sports, they like to take MCTs to get lean and fit. They use it as an energy source. Apparently, when you take it half an hour before your sport, you have a higher burst in energy and can, and kind of overcome the fat burning stage quicker. Because in the beginning I'm not, not a muscle physiologist, but apparently you get higher ketone bodies, and then normally your fat will kick in, the fat burning will kick in afterwards.
right? And presumably there's also not that corresponding insulin response that you get from the sugar drinks or the carbohydrate drinks that a lot of athletes take, which in effect dulls the response. Interesting.
Yeah, and I think one of the, I think that I'm thinking a lot at the moment, right? Because I think in every second sentence. But
I'm glad we could challenge
you.
it.
Yeah, I'm glad I can come out with that now. Yeah, but we were all taught that you have to keep your glucose level high, right? This was one of the dogmas. So you have enough energy, before you went to an exam. I don't know if you guys had this in Britain, but definitely my mom always gave me some sugary stuff, right? So we're like, whoo, and then you get like boom in the middle of your exam, right? Yeah. So it's an interesting fact. Or we eat, we drink coffee and eat something sugary, so you have like the second hit after a while. So yeah, and then you get so dependent on it. And I was, when we did this, and start with the research, I was quite fascinating that, because it was one of those dogmas which changed. We always learned that you need sugar for your brain, which is true. Saying this, our ketone is a fantastic alternative source for the neurons. The glia cells need more sugar than the neurons, actually. So I think that is all highly interesting, and I think we will learn a lot in the next coming years.
So we should all really eat a lot of Thai food, shouldn't we? Because that has coconut oil in it. But isn't palm oil a medium chain?
Yeah, palm oil you can also use. Yeah, but I didn't dare to say that on public, because you said you can use it everywhere in the world. So I thought I didn't want to use the palm oil thing.
We've discussed palm oil a few times on this
pod
before, because I'm we both are morally against palm oil, because
you see, you were digging the hole. I was digging the hole.
I was digging the hole for you,
giving it.
Well, this is the problem. If you go on to, if you Google, is palm oil ecologically friendly or environmentally friendly, then it's a tough one, because to have got the palm trees in the first place, you have to destroy a lot of primary rainforests, and you get these monocultures of palm trees. The argument is that now they're there, the ones that are producing palm oil are probably quite environmentally friendly, because the output of oil per hectare is much higher than with maize oil, corn oil, things like that, peanut oil. But it's a shame it had to happen. But having happened, let's enjoy the benefits, which I must admit, my wife and I are quite pleased about, because we like Ferrero Rocher, and they got palm oil in, and so for about 2 years we righteously denied ourselves Ferrero Rocher. But Greenpeace have come out and said, no, it's okay to have palm oil as long as it's from established palm oil plantations. So we can go to the presidential dinners now and have those little pyramids of Ferrero Rocher again.
I hear justification for bad habits here.
Is that a teleological explanation, you think?
I think so.
So I wanted to ask you, I was going to say pick your brains, but actually quite literally pick your patients' brains a bit, because you've also got a huge interest in syringomyelia and gyri malformation. And I know you've done an awful lot of research on that. I was going to explain to the audience what that is, but I have a triple professorate in neurology who I thought maybe could do that.
Definitely. It's an Italian dish. And yeah, so the main reason why I started doing research in that area, and to be honest, sadly so, I think the Cavalier King Charles Spaniel is not as common anymore. Also in Britain, it's definitely not very common here.
No, it's a shame.
I'm not sure if we did something the right way, you know, after some of them being on Panorama and whatever, you know, they definitely had a hit, and they're lovely dogs, you know, from a character point of view. Now we have all the French bulldogs. No, that's the replacement of it.
It's French bulldogs and biscuit-colored dogs.
Yep. Yeah. Definitely biscuit colored. Yeah, and I mean the thing why we got interested was because they have central neuropathic pain. So neuropathic pain, in to explain it easily, is a pain which is normally not derived exactly. You don't feel it where it arises, and the one which is the most common in people is when you have diabetes mellitus, right? That's when we have it. We don't know really if the same exists in dogs and cats. They do have, from a neurology point of view, they have a bit of a sensory deficit, but we don't have. I mean, we haven't seen really that they appear to have neuropathic pain. But Cavalier King Charles Spaniels came obviously a lot in the media because they developed syringomyelia, which are fluid-filled pockets within the spinal cord. And one of the reasons, or we still don't 100% know, there are a lot of theories of what has happened, but to say it simply, they have a Labrador brain in a skull of a Cavalier King Charles Spaniel. So they have a too big brain for the skull. And that's another thing which I thought is fascinating. And when we did the work at the RVC, I always thought that the bone cavity kind of, you know, gives you the space a brain has to grow into. But as always, as you know, when you feel on any notch where the arteries are running over, the artery is you know, stronger than the bone because due to the pulsation. And the same happened in the Cavalier King Charles Spaniel. So there was a missing communication between the brain growth and the skull growth, and then they have a malformed skull, especially at the back of the skull, the supraoccipital bone, and when it continues the disease process, then supraoccipital bone gets actually very thin, and you have like whole foramen magnum. And the thing why a lot of people became, you know, interested and irritated by the disease process is because these dogs showed phantom scratching. So they looked like scratching behavior, but they didn't touch the skin, and they were very sensitive. And the work we've done together with Ludwig Pelligon at the Royal Vet College was we really objectivize what type of pain they have. So when we talk about pain, we often are very global, right? But we know that you have pain on, you know, on being palpated on, or there's like little free elements where you can be very, very accurate and give you just like a tingling sensation. They have cold, I mean, heat and cold can also cause you pain, and pressure can, I mean, there's different things, right, from different stimulation. And what was very interesting in the Cavaliers was that when you went down and cooled them, that at a certain temperature, they actually showed the response. And yeah, and so it was very different than the ones who were not affected, or the other side, because there's always, when you see a Cavalier, they often have a little spot where they're really highly sensitive when you touch their neck. and then we did a couple of medication, and one of them was pregabalin, and they actually improved when we gave the medication. So we showed, and pregabalin is a drug for neuropathic pain. It showed us that probably a little bit of our proof of principle that it is actually true what we are finding. Saying this nowadays, we use this actually now in clinics as well. We quantify pain and look at the different types of pain and then modulate what pain medication we give. That's what I do now in Hanover. Yeah.
Yeah, and omeprazole as well can have an effect, can't it?
Yeah, there is it's a little bit of debatable. So we know that, I mean, one of the theories, like I said, there's many theories, but one of the theories is that there's a little bit too much pressure in the skull of the Cavalier King Charles Spaniel. So you have, one of the laws is that you have fluid and tissue. And obviously in the skull, you will have the brain tissue, then you have the CSF, and you have blood, right? And in those cavies, what you see is they always have a little bit of a bigger ventricle system. And we did some, I think, really fascinating research, because we've shown that dogs which had syringomyelia had a higher pulsation of the brain. So when we are sitting here, we kind of think that our brain is steady, but in reality, it's constantly moving. So which totally makes sense if you think about it. You get your heart, causes a contraction, you get a pulse, this pulse goes in your brain, that produces your CSF, and so the whole time your brain is extending and going smaller again.
But we've all seen that on Doctor Who. That's nothing new, is it?
Yeah,
the Master Dalek, has the brain that does that. But I don't know why. I may be being a bit naive, but I don't know why you didn't sort of look at those old episodes. But there's something.
Yeah, I should have done that.
I don't mean to tell you your job, but
no, I should have done that. Yeah, but at the end of the day, we found that the pulsation was higher in the dogs which were affected compared to not. And then and one of the ideas was that because of those pressure changes, they might also drive the disease. Yeah.
Okay.
Sorry, there was a bit too much, not enough rambling here, I realized.
Okay, well, I've got this. I've got this.
You become so serious. You talk about it.
No problem. Yeah. What I want to know is whether the density of the brain tissue, whether it's more dense in a Cavalier King Charles because the skull is so much smaller. Because I've got a small skull, and my mum always used to say that I was dense.
We're back to the effects of maternal.
Yeah. I thought we would try to stay away. That moms give us energy.
Let's move on. Let's move to a safe topic. Think of a safe topic. I know. COVID.
COVID,
a safe topic.
Definitely, that was definitely a highlight of our life in a couple of years ago.
Was it? Do you remember? Anyone remember that?
Yeah.
Gone now, of course. But it was.
We've lost 3 years. We've lost 3 years of our lives. We'll never get back.
No, but I mean, it looks like you guys are nice suited, and look, we have a country house as well, so we are okay, right?
I know. I mean, looking at the lovely beams in your house, they're fantastic.
Yeah.
Is it very modern?
That's a nice
look old.
A nice story. They're true. It's actually, this is something you might be very interested, because we lived in a beautiful old chocolate grade 2 listed cottage.
Yes,
was beautiful. And it was from 1640.
Wow.
Or that's what they say. And this house is from 1652.
Oh, yeah, amazing.
And it's actually quite interesting, because the oak I mean, this was a classic, so it had like each room was built probably in a different time. And so it was all put together. But the oak there, the green oak it's so much softer, which is, I know, sounds a bit weird, but the German oak, I guess, like the Germans are, we are a little bit more tough on the outside, and it's not as smooth. Actually, your oak is a lot better. It was really, and I strapped all these beams myself with my 2 hands, and my daughter. I mean, my daughter still lives. That's very nice, right? But, yeah.
It's well, I think what you've seen there, what you've experienced is one of those old classic things. It's British precision engineering. But I wouldn't expect Germans to understand anything about that.
No. And I do realize it in the past, right? Yeah.
We have a little phrase in England which goes something like "Vorsprung-Technik." It's an old English term.
Yes.
It means it developed through technology. And
Yes.
you should get a dendrochronologist to come and look at your beams.
Definitely.
Mm.
Yeah.
I don't know, and we'll have to get one on the show. But the reason I brought up COVID was because you had something to do with detection of COVID.
Yes.
Which is an odd
and still
venture.
do, actually. And
Brilliant.
still do.
Go on.
Mm.
Yeah, so that is an interesting story as well, because when I came over 5 years ago, we looked at different areas of research, and one of them was using scent cognition. So the cool thing is that dogs can see their smell. So they have actually a neuronal connection between their smell and their occipital lobe, where your vision is, perceived.
So that's a
I've come across this
synesthesia,
before.
isn't it?
Say again, sorry.
A synesthesia, isn't it?
Yeah, yeah. So they can, at the end of the day, we can't do and perceive the world. We are visual, right? We are visual creatures.
Yes.
And I think this is part of why it was quite an interesting thing, because I think we had a solution for big events very early on by using sniffer dogs. So we used our knowledge from scent detection, and I had good contacts to behaviors at the German Armed Forces, and we published the first paper ever on that subject, which has been everywhere in the news, everywhere. It's just a very small paper, it was one of those COVID dreams. You submitted a paper, and a couple of days later it was published, because everyone was so, we need information, because everyone was bored at home and wanted to read something. Right. Yeah. And then we showed in multiple events that the dogs were able to sniff out samples with COVID. And the interesting thing as well was that there were so many countries, and also the UK, the medical detection dogs, which is a great charity, and I think you guys need to support, is, they have done some great work there as well. And one thing in science, we talked earlier about the MCTs, I published something, and then we did the same study again, and so on. But it's rare that similar research is done multiple times and is confirmed. So there was in very short period of time, many countries were working on the same thing and found exactly the same what we did. So I do think that dogs can smell samples of COVID. What do they smell? It's very difficult to know. We do know that when the virus is getting into the cell, they change the smell. I mean, vets, right? We know when we can smell when an animal has a certain infection, like a bladder infection. When they have a UTI, you can smell that the change. We can smell, if our loved ones are potentially sick. If you are working in a hospital, we walk into a room and you think like, there's something going on here. We have a perception as well. And the dogs, they could definitely sniff out the people with COVID very, very quickly. And we did so many studies, and I, it's one of your time in your life. One time I got 1.5 million from the German government to organize parties. So I organized like 4 big events to show that the dogs are working. And this is one of the things you do once in your life, right? So
wow, fantastic.
Yeah, because the interesting thing, I'm not sure. I'm sure the British are, a lot better than that. But in Germany, a lot of people fake those certificates. So that was one of the reasons why they didn't want to open any big events anymore, because people were just faking the test results, right? Because suddenly every corner store had suddenly a testing center, right?
Sure. Yes.
And many of them, some of them, if you're not too crippled in your IT skills, you could kind of drum up one of those tests, right?
I'm sure.
And the dog is not easy to be fooled, right? And the interesting thing was as well, and I think that's very important for us vets, because we often don't see ourselves there, is we compared the PCR to the lateral flow test to the dogs. And then we asked people which test they trusted the most,
Hmm.
and it was a dog.
Was it?
Yeah.
I've come across this. What was the name of that charity again, Holger?
The medical detection dogs.
Medical detection dogs, right? Okay, I've come across this from the physiological
Yeah,
side.
they're close to Milton Keynes.
Right. Okay, because
We'll put a link to that on the website.
Yeah, we can do that. That's very easy. I have to say that I love the way that you described that, because as humans we're very sight centric, aren't we? We experience our world through vision, and a lot of the words that we use, perceive, as an example, it's all sight centric.
Yeah.
And of course, dogs and other animals don't necessarily see or experience our world in the same way that they do. It's the vomeronasal organ, isn't it? That's well developed in dogs.
That's a very good point. Yeah, they have more opportunities to, smell better. Not only their olfactory bulb is a lot bigger in size. They have different ways of airflow in the nose. They can differentiate easier. Then the surface is bigger. They have more genes, so they can probably be a lot more specific. And then they have the vomeronasal organ, which can probably smell, taste some protein structures. So they definitely are. And I think one of the things which I thought was really interesting, what I said earlier, was the public really trusted us, but the scientists didn't trust us, right? So they said, oh, and then you were like, hey guys, you use a lateral flow test, which was not even certified, and that you trust more than, and yes, I mean, they are right. I mean, you can't, just take any dog from the street and just go ahead and do that.
Sure.
And there are some ethical concerns and some safety concerns as well. But when we enter a plane and go somewhere, I think we would all feel safer if a dog goes sniffing through than the man with those little tissues which they put in a beeping machine, and you never know if it's actually detecting anything, right?
I hadn't thought of it. You're absolutely
security, right?
Absolutely right.
Yeah, and there would be everyone would trust the dog, but as soon as it becomes medical, then they think like, And we do know that until now, the dog is more sensitive than any machine has ever been.
Yeah. Well, there are well documented stories of dogs sniffing out Parkinson's, aren't there?
Yeah, exactly.
And various cancers.
And they can predict epileptic fits.
Yes.
Exactly. Yeah, and that's an interesting one as well, because there was a study where they've shown that the dogs detected it even before the EEG changed. Even the brainwave activity was not changed yet, and the dogs already detected that something was going on. How do they do that? I have no idea.
Incredible, isn't it?
That's because they map their world by scent.
Yeah.
Rather than sight.
Yeah.
Descartes has got a lot to answer for, hasn't he?
Yeah, here's another pub fact you can tell someone is there's one. I mean, I'm sure everyone thinks about why does my dog know, or why does a dog know when someone is coming home? And we always think they have a good hearing because they can hear the car. But actually, what is happening if you are in the house and then you leave, your scent will go down over time, right? And the dogs, apparently, that's one of the ideas behind it, that they probably realize that what you have exposed is less there, so they will send less of you, and then at one stage they know that you will come when they have probably a certain level of scent.
So, leaving a jumper, the old trick of leaving a jumper next to your dog.
Exactly.
Dogs aren't easily fooled. I mean, that jumper's going to really stink, isn't it? But they're going to see.
Yeah, but I do think it helps. We do this for our old dogs now. We give those scent anchors. So we do know that older dogs get more anxious, and and one of the ways to comfort them is that when they feel really at ease, that you give them, something they can smell, and then you use that as a smell anchor, and you teach them that this is when they smell that, it's obviously a comfortable and non-anxious time, And then when they do become a bit more anxious, then you give them the scent, and that works and calms you down. It also works for us, right?
Yeah,
Mm.
yeah. But there are certain smells that just relax the heck out of me.
Yeah.
And I think I've told Mike this story before. But I was climbing once in Greece, and I was on a particularly gnarly route. The bolts weren't particularly secure. I was sure that I was going to fall to my death. And so, yeah, sensibly I carried on. But there was one really difficult move, and I missed it the first couple of times. Just made it, and suddenly, out of nowhere, there was this smell of oregano, and just round the corner there was this tiny little oregano plant growing out of the cliff, and I was so distracted by this amazing smell of oregano that before I knew it, I'd made 2 extra moves just to get closer to it. Oh, wow, this is lovely. Taking one hand off the other. Well, I should probably picked a little bit and put it in my pocket, and then carried on climbing, just so I could say to my friends who are up at the top, I smell this, isn't it wonderful? So now I never go climbing without oregano.
You still have it in your pocket then, or?
I still have it in my pocket, yeah. Not the original bed, I've cleaned my trousers since then. Now, I wonder, Holger, whether we could tempt you to take part in a little challenge.
Oh, definitely.
Is that about the right sort of time, Mike, for that?
What are you referring to? The 60-second CPD challenge?
Oh, the full minute.
You know that I did not prepare. You know that. So I will do my best.
I love it when I get
professors, Holger, you don't need to prepare. It should just straight off.
I love it. I love it when guests prepare. It's really good. They also claim that they've come across the show before and they know exactly what's going to happen and all that sort of stuff. And that's a lie too.
Absolutely. No one ever watches this. I know that.
I know.
You know.
Right.
You can't tell me that I just spent behind, with my German oak. And
I love that oak.
It's all good stuff. Actually, no, I mean, it would be remiss of us, wouldn't it, when we've got Professor Dr. Hare, we'll just call him Holger, in the chair with us, and we don't ask him for some 60-second CPD, because it's got to be good, hasn't it?
It's got to be fantastic.
It's got to be good, because you earn your living doing teaching, don't you?
I love it.
And research. Okay. All right.
Well, so, if I'm just going to take another little ramble here, because we know that Holger likes teaching.
Mm-hmm.
Because if you like something, you're good at it. And if you're good at something,
I'm not sure if I'm good at it, but people come again. So
well, I think you are numerically the highest recipient of the Jim B Award for teaching at the Royal Veterinary College. Jim B was a friend of mine. He was a lecturer when I was at college and sadly died.
Oh, really? I didn't know that.
When I was there. Really, really
Julian
nice
really is that old.
I really am that old.
Yeah, I would have not thought. I thought it was 25, but that's interesting. Yeah.
Yeah. We just act like children.
I'll buy you that drink at Congress. But no, Jim B was a fantastic lecturer, and in his memory, the Jim B Award was set up to honour really inspirational and liked lecturers. And how many times have you won the Jim B Award?
Twice.
How many other people have won it twice?
I have to say, I think one of the nicest things in our profession is to inspire others to feel the same passion for animals. No, so if you feel passion, you obviously don't have to work a day in your life, and that's And sometimes we get a little bit of drawn into the other discussions about everything is bad and how awful and da. But actually, I think we have the nicest profession on the planet. We are the only ones who can actually kiss our patients, and our owners love it, right? So if you're a human doctor, right, and you would kiss your child on the head, they would like, ooh.
Yeah, absolutely. Yeah.
Did you get a clearance for that? No, and there's a funny story about it, because there was a time when there was the super vets, right? And that was a BBC series, not the super vet, but the super vets. And I was actually on the first series, I was an intern at the RBC. And then the second one, I already moved higher to be a resident slave. And and when I was the intern, I had to give a Daxi home, right? And this was a rather large little Daxi who had a disc surgery, as you would think, right? And we were talking about diet because obviously, we know that the shorter and the legs and the longer the body, and as more obese they are, as higher the chance of getting this disease, right?
Mhm.
And then I had this talk to the owners, and the dog was on my arm, and I gave him a kiss on his forehead. And I just did this, and then I had like everybody loved this German with this rather German accent. Yeah, I got so many mothers of colleagues in the hospital. Yeah, and then the
Wonderful.
funny thing
Yeah.
is that the lady went, and the television crew went with them, and they went to South Mims, and then obviously what did they do there? They bought the dog a burger. So I gave all this talk about, dieting and all this, and then, no, Matt, it really has to, it has to, after this hospital time, it has to have a burger now.
But maybe it was fried in coconut oil.
It might be,
Mm.
I think the dog would probably reject it, even though it was burnt. It's going, I could smell beef in here, but what is the smell of this nut thing? Okay, all right. So back on 60-second CPD then.
Yes.
So what are you gonna CPD us for 60 seconds, Holger?
Clinical reasoning.
Clinical reasoning.
Yeah.
Good gulp.
Okay.
Okay. All right. So let's set this up then. So Holger Volk, 60-second CPD challenge on clinical reasoning, starting now.
Neurology is far more than MRI. If you know the 5-finger rule, you can unravel every riddle you have in neurology. It's actually quite simple. Think about disease, how it's onset, how's the clinical course, is it symmetrical or asymmetrical, is there pain involved or not, and then you do the neurolocalization. When you do that, you will stratify any disease process which is there. And then when you have your differential, you think about the signalment. Never think about the signalment first, because when you do that, you often have a cognitive bias and you do it wrong. Every Labrador doesn't have elbow dysplasia as the other way. If you think about diseases which are symmetrical, these are the diseases which have normally intoxication, metabolic, they are outside of CNS and they are very diverse. If you think about diseases which are painful, that's normally inflammatory, infectious, neoplastic. If you think about diseases which are asymmetrical, they always have an altered structural event. And if you do that, you can solve every problem.
Spot on.
Very good.
Amazing. Absolutely incredible.
And I did not prepare that. That's the thing. I just
Really?
showed it out of my head. And it was probably, you could have done this a lot better if I would have been prepared, but that's okay.
But I'm glad you didn't in that case. It was perfect. Spot on.
That was absolutely
The
spot on.
The 5-finger rule. I've heard you.
5-finger rule. Yeah.
I've heard you speak about the 5-finger rule. Before.
And the nicest thing on the 5-finger rule is that nowadays everyone is using it. No one knows where it came from.
And it came from you.
And it did come from me. Patrick Kenny, who is an Australian, he says there needs to be a 6th finger because Australians always have some weird animals. But yes.
But a lot of Australians have 6 fingers and they're webbed. So.
Yeah, definitely. No, but joking aside, when I remember when we came to the RVC, the neurology was not the most loved subject, and people always talked about all the pathways. And as a student, when you see an animal, you can't bloody remember all these pathways. They're far too complicated, right? And when we developed the 5 fingers, and the first 4 actually so much more important than the localization. Every neurologist will tell you everything. The localization is the most important, but the localization only tells you where you have to look. If it's a C1, C5, or C6, T2 in the neck, doesn't really make a difference so much because you image the neck, right?
Yeah.
But if you understand the other points, then you can very easily come to 3 differentials very easily. And now it will be in the new BSAVA manual. If it's ever getting published, then it will be.
I believe it's due to be published next January.
Oh,
okay. Maybe even earlier, but it definitely will be.
It will be. And yeah, and it's now used by many of the lecturers at the RVC, and I think neurology became from one of the hated subjects to one of the most loved. And the guys who are now at the RVC are really great, and they still get amazing student feedback. And and I think people lost the fear of neurology. There was always this neurophobia, and I think that's definitely something we change because we didn't focus anymore. I compare it always with math. If you ask people who are not good in math, let's do some math, and as soon as you say the sentence, they like, oh, right? And it's the same as if I tell you, come on, let's localize. You go like this, and they will forget. But everyone can say, oh, this disease is symmetrical. Everyone can say the disease has a, acute progressive or acute onset and then is improving. And then, that's easier, right? It's something everyone can do.
Absolutely. I've always loved neurology, but then I'm a bit geeky about the suprapyramidal and tegmental pathways and things like that. I love learning the minutiae of that. But actually, if I'm in a consult, I do now use the 5-finger rule always. And it's you mentioned signalment as being one of the last things you look at.
Exactly.
And you mentioned that in a lecture that I went to a few years back, and I thought, I do. With just about every disease, I think, okay, so we've got a Labrador coming in,
exactly.
And it's limping on its front legs. So let's look at the elbow dysplasia. And even though I think, well, I'm doing a really good clinical examination, I've got pre-consult bias there.
Yeah, it's normal because our brains are lazy, right? But if you turn it around, then you will be right. So if you take the signalment as last part and you look first at the clinical reasoning and then narrow it down by the breed, sex, and age, then normally you're far better hit. It sounds like it's the same information, but it's actually the opposite.
Yeah, very useful.
This is fascinating. Holger, I want to ask you this because you've said a number of things in the last few sentences here, which have really intrigued me. And I forgive me here. I want to get a little bit personal. You've won the Jim B Award twice. So are you the defending champion?
I'm actually not sure I'm sure there are some others who have won.
I think you are.
All right. So you're the defending champion. You have coined and developed the 5-finger rule to help general practitioners deal with neurology, but you don't appear to be bothered that hasn't been called the Holger Volk 5-finger rule. That's just away there. So do you like sport?
Yeah.
You do? Do you do sport?
Yeah, I used to do a lot of horse riding, but now I do more like I have 2 kids which are still in the younger, so yeah, I go bicycle and so on. But I'm not competing in any front anymore. I used to compete.
You used to compete?
Yeah.
Okay. I have to say I find that fascinating because very often with sports people there's an ego.
A lack of altruism.
There's a lack of altruism and there's an ego. I have a small ego. It's got a voracious appetite, but I have a small ego. And I've been through competitive sports all my life. But you seem to have this altruistic view and this very calm and relaxed view. And even as defending champion of this award, it's going to be somebody else's time to inherit this, and well done to them.
Yeah, but I get my dopamine peaks from seeing others excel, and it sounds so cheesy and often misused, but I definitely do. And when I can tell you a little story about my 2 weeks ago. I was at a conference and I saw a former student of mine from the RVC. So I was in Germany at a conference, and she does sell dentistry equipment, and it was so nice to see, and meet her again. I couldn't have not told you which year she was in. I would have, to be honest, not really known her name. I had a kind of a hint in which direction it goes, but I recognized her face, and she was so happy to see me. And so whatever I did in my times as a lecturer, I touched her and inspired her in some form. And that's all what it's about, right? And it's the most productive we can be, that we inspire others and hopefully make them a little better world, right? That's just how it is.
Yeah.
And that gave me a kick, right? That just, and I find this actually quite between us, I really loved being in the UK, and it's not always easy to be back in Germany. Now it become very personal because Germans are quite odd, right? And they are, they are always so serious, right? Until you crack the first surface, and then they become a bit more relaxed. And the students, what we had at the RVC, and that's why I'm still so fond. There was just a relaxed atmosphere, and we were so proud of them. And now in Germany, it's a more like a hierarchical thing, and I'm sure I will sure crack them because they get a bit used to me now, and that I'm
Sure.
approachable. They actually, and someone gave me that feedback. They couldn't believe that I'm always so enthusiastic and so positive, and that I'm always interested in them becoming better. So they thought I'm not authentic, but I'm so authentic, and I really mean it. And isn't our world weird that we can't believe that if someone wants your good? But that's how, man, that's, like I said, but that was a little bit of a shock, because now, when I look back from the UK times, it was more present that you are enriching the life of others. And in Germany, it's still, I think, that a little bit of work. Yeah. So that's how it is.
Yeah.
Lovely thing to say.
Really is. I think us in Blighty aren't too bad, are we? But yeah, there's a sort of more generally appreciation, I think, of other people doing well on the basis of a little bit of encouragement and support, and there's a wonderful feeling you get from seeing someone blossom, isn't there?
Exactly.
You teach someone, you give them the tools to do a job, and then they do it. Wow. And then there's a part of it that's great. I've been a part of that. Yeah. There's another part, which is actually the delight in seeing someone take the same excitement and interest over something that you find interesting and exciting.
100%. And I'm definitely not altruistic. If I had a big idea and I share this with someone, and then they do the research, then I get it. Then I get pissed off as well, right? Because then I wanted to do this myself. I wanted to find it out, right?
Yeah.
I mean, that's the normal thing. I'm definitely also competitive in some form in that regard, but that's the normal thing.
Yeah.
Otherwise you wouldn't publish papers and do things,
And you do, and we haven't even touched on the number of papers you published, and I'm afraid we haven't got time to do that.
No, that's fine. That's fine. I think they're all bored by now, but at least we had fun.
Well, maybe that's the second Holger Volk interview we do, but for now, you've given us 60 wonderful seconds of CPD to dwell on. And by dwell on, I mean reflect on, because we have to reflect, don't we, for CPD to count. And if you want to log your CPD with the RCVS or the German authorities, then you need to have some sort of reflection. So could you give a reflection question or an idea of reflection for the listeners?
Yeah, sure. I think they should think about how diet can affect brain function, right? That would be one. I think people should think about how our dogs, I want to say see the world or smell the world, right? Perceive the world would probably be a better word. And
experience the world.
Yeah. And I think people need to reflect a little bit on how they do the reasoning, and perhaps if they take one thing out, and I think you both would agree, would be to take the signalement as the last thing you take in your clinical reasoning and not as your first. And you can apply this for anything.
That's brilliant. That's lovely, Holger. I think that's absolutely super. Julian, I need to ask you a question.
Yes.
Because Holger has very patiently sat here and entertained us fabulously this evening. He's educated us. We've had our CPD. We've got a fantastic reflection question, which I really do like, because obviously that's an interest of mine, that we don't all experience the world in the same way, although we all think we do. I hope you've got a CPD certificate.
Do you know, I just so happen to have one. And here we go. It's a certificate of being many professors. So let's talk you through this, Holger. We have a B, That's in a nod towards the Jim B Award.
Yeah.
There we go. You can see that little bee there.
Fantastic.
We have a dog looking nose on at the camera, so that's to look at the amazing work we done on sniffer dogs, dog sniffing. There's a Cavalier. We don't see many of these.
Oh, I love it. Yeah, yeah.
And here is a mosaic dog. And this is here for two reasons. One is because I think dogs are mosaics. They're made of many different parts that we can just examine. You can go all metaphysical on this, but the main reason I had it here is I haven't got a photo of Julius Caesar. But of course, rather famously, Julius Caesar was epileptic. And I wonder whether his diet, which wouldn't have had any palm oil or coconut oil in those days, whether he would have benefited from a better diet. And finally, there's
fantastic.
There's the 5-finger rule. This is a hand that has just survived that climb I was telling you about with the oregano. So that was me after that oregano climb.
That's amazing.
So
but I would love to have a copy of that. Hey,
I will send it to you. I'll send it to you.
Amazing.
You'll get a copy of that. That's brilliant. I suppose it's that time, is it, Julian?
It's about that, isn't it?
It's that time. Okay. In which case, it beholds me to say, Holger Volk, thank you very much indeed for joining us today. And to our audience, if you've liked the company of Holger as we have, then please click like, share, and don't forget to subscribe because it really does make a difference to us. So, Holger Volk, thank you so much for sharing an insight into your fascinating life. May your dog go with you.
May your dog go with you.
Cheers.
Cheers.